Although the experience of dying is different for each of us, the decisions that care partners face at the end of life stage are often very similar. Today we're meeting with Gary Goldsand. Gary is a clinical ethicist, and he helps people deal with these sorts of questions every day. Gary, what exactly does a clinical ethicist do?
The clinical ethicist is a new job in a hospital where we try to support the staff and patients facing ethical dilemmas or ethical challenges, tough decisions they might face in the course of their medical care. So we'll try to intervene, clarify, facilitate discussion, and hopefully bring some understanding that helps them make a good decision.
That's a great addition to the team. So how would you define an ethical challenge? What is it?
Ethical challenges affect all of us in our daily life. Whenever we have a choice, shall I do this or shall I do that? That's a difficult choice. We're facing an ethical challenge. In the clinical setting, there are often times where we're not quite sure what is best or what a patient might want, and therefore, in making good decisions, we often face ethical challenges in clinical care.
What ethical challenges can a care partner expect to face in the late or the end stages?
It's very difficult for a care partner who sees that their loved one might be approaching the end of their illness to figure out what the goals are when the goals change from trying to slow down the illness or perhaps cure the illness to an acceptance that the illness is probably going to overwhelm someone is perhaps the hardest thing to figure out. When is it okay? Nobody wants to give up too early, but at the same time, we don't want to blind ourselves to the fact that our loved one may be dying. So I think the key thing is to figure out when is it okay to consider that the patient's death might be occurring naturally and doesn't need to be fought against anymore. Rather, the more appropriate thing as somebody is dying is holding their hand, reassuring them that they're loved and that they'll be remembered.
Sure.
And so figuring that out, I think, is the key at the right time.
Thank you. Now, how can they prepare for the tough decision-making that's involved?
Well, there's no doubt that thinking about things in advance is helpful. When a patient gets to the end stages of dementia, they have probably gone through months or probably years of a slow decline. So it's certainly the case that when possible, families should try to talk to their loved ones in the early or middle stages of illness about what they might hope for, what they might expect, and through that get a better sense of what is the patient likely to want. Now, the difficult thing is that it's hard to say that any of us can really predict with certainty what we're going to want next month or next year. So I think it's helpful to know, but we don't want to hold patients prisoner to something they might have said 2 or 3 or 5 years ago. I think patients expect us to consider seriously what they've said and make a decision that's best, all things considered.
Yeah, that makes sense. So how do you help care partners navigate this experience?
Well, ideally, a care partner is part of a larger team of caregivers, a physician and nurses and others that help address the patient's clinical needs. What we would encourage is close communication throughout a patient's illness between patient, loved one, and the rest of their team, so that everybody's on the same page about both what is happening, what is the rate of the disease infiltrating into the person's life, and those open lines of communication that are essential. Very often, if a patient is at home, caregivers might not see day to day what's happening, and similarly, if a patient is in a hospital or a nursing home, the staff might have a better sense of how a patient's doing day to day. So there's no question that for really good care planning, we need good communication among the key people.
Care partners have a lot to consider. How would you explain the goals of care at this stage?
Well, patients and families always have goals in what we're trying to do for them in the medical system. Normally, when we first come in and we're not sick and we think there's something might be wrong, our goals are absolutely for recovery and to be healed and to take the best that medicine has to offer. Mm-hmm. But all of us, as we live our lives and potentially go through some illnesses, will eventually face the potential of death and the potential for there being no treatment that will help because our condition is a predictable terminal condition that leads towards death. Mm-hmm. So Alzheimer's disease is a progressive dementia, just like that. We can't predict how fast it will go, but we know that it will go from higher function to lower function. And so the goals need to evolve as the patient's function evolves so that we can treat them the right way. In the disease, there might be things we can do to really improve function. Mm-hmm. But the key is that towards the end, we transfer our goals to make sure that each hour of each day is as good as it can be. So that's what we call comfort goals, maximizing the patient's comfort. Mm-hmm. And not lose sight of what we're trying to do, which is to potentially administer treatments which are not going to help, not going to lengthen life or make life any better. And so knowing the goals is key to knowing what to expect, what to hope for, and what to do for the patient.
That really makes things clear for me. Thanks.